So we have seen people be able to significantly reduce their curve. You can't ever guarantee that. There's so many factors involved. But what we feel pretty confident about in our clinic is that we can stabilize curves so they don't get worse, they don't progress. There are a couple of precautions that I want, I don't know if that would be useful for us to go over.
Yes, absolutely.
I do want to say that, just briefly, that, we use postural restoration exercises, like I said, 80 to 90%. But we sometimes have to often have to modify components of those exercises based on the curve of the person that we're working with. So again, that's why we like to have the x-rays, and we watch people really carefully to see what's happening in their body when they do these activities. Anyway, I wanted to be sure that we just touched on some of the precautions. We call them spinal protections. The spine, because it's already side bent and rotated and twisted, we want to protect the spine and not put it through more torsioning, which Jean showed us when she did that whole demonstration. And so we recommend people avoiding extreme flexion, forward bending, extreme back bending, extreme side bending, and twisting, all of those extreme positions. So for instance, if you were going to give somebody a postural restoration exercise that tells them to round their back maximally, we would not want them to round their back maximally. We would be watching them to see at what point when they take this position, does that spinal curve begin to be more prominent? Because that's where they're starting to reinforce it. And we don't want them to go back into a position that reinforces their curve and then work from that position. So we're going to back them up and say, this is as far as you're going to go in this position. Now you can complete the exercise.
Okay.
And we want people to avoid compressive activities. When a spine has curves to it, and anything that you do with your arms, that heavy carrying or lifting, is going to put pressure through your spine, and that spine is going to take that pressure by going further into curves. It's going to compress into a curve. We want people to be elongating and lengthening, giving themselves more inner space. We all have more inner space. We get compressed over the course of a day, and a lot of the exercises that we do with postural restoration give us more inner space. We want to feel more inner space. But for instance, for people who like weightlifting, they have to be very, initially especially, we tell people weightlifting is not a great idea, especially if you're doing the same thing on both sides, because you're reinforcing the pattern that you already have. You need to learn how to get into a position that maximally untwists your spine before you start really working extremities to get stronger. So that repositioning is really an important component.
I would say a lot of people associate elongation with standing up straighter, but I don't think that's the same thing. So can you just discuss that?
So thank you very much for bringing that out. That's really true. There are a couple of actual lengthening decompressive techniques in postural restoration. For instance, the lat hangs up, and also the long seated press downs, where you're actually
just really hard.
They're really hard.
Really hard.
Tractioning act. I know you can't start those right away, but
no,
think of this, Neil. A 90-90 hip lift is a tractioning activity.
Yeah.
If you can keep your back down and just lengthen your pelvis by doing a little bit of a posterior tilt.
Right.
That's the beginning of a decompression right there. Another really beautiful source of decompression is air.
Yes.
Able to breathe. Being able to breathe in that unwinded pattern right apical expansion, left PME is a great untwister and decompressor of a spine. So there are many. Another one is like balloon blows, where anything that you're doing to approximate a rib cage and a pelvis is decompressing a spine in the back. The more a person is in an arched back, very lordotic position, the longer they are in front, the shorter they are in back. Just beginning to get sagittal plane, more anterior front approximation is going to begin the process of elongation before you can get to those really hard techniques.
Right.
But
And
those
just,
really hard techniques are important for people with scoliosis.
just, just some people might not know approximation. So it just means in front, we want the ribs and the pelvis coming closer together. And that would be approximation. All right. So just because I know that that word might not be
yeah, thank you.
understood by every single person.
As things come closer in the front, things are going to separate in the back, and the spine is relatively in the back compared to the rib cage and pelvis in front. So you're already beginning the process with basic postural restoration activities. We do have protocols based on postural restoration exercises that probably need modification for your patient that has this curve or that curve, the unique curves they have. But you know, it's just a suggested pathway to take to deal with multiple issues that people who have scoliosis have to pay a little bit more attention to.
And what is so besides this, so we don't want to twist and side bend excessively. And you definitely, I'm pretty sure you're going to work a lot on sagittal first. When do you know, how do you know that it's safe to go, how do they exhibit sagittal competency that you can start to then shift them after that?
Well, when we're in the clinic, of course, we're doing testing and we're seeing the beginning of neutral tests.
Okay.
Right.
Can you just explain that? I think a lot of people might understand neutrality. Can you explain how what you're looking at with these tests?
We're looking at the ability of the pelvis to be in a position that allows the leg to adduct. Mm-hmm. We're looking at the rib cage in a position that allows an arm to internally rotate or to horizontally abduct. These are just, you know, the usual postural restoration, basic sagittal plane tests. We've had to really think about how to do testing when we're doing teletherapy sessions. Mm. So some of those work and some of them don't. Right. You know, there's the sideline tests where you're looking at HABD, and the lift test are other tests that come a little bit later on. But we're using traditional posture. We're looking at cervical rotation. We're looking at how does the neck move. A lot of folks who have scoliosis, because the sagittal plane is always having some issues, whether they're excessive flatness or excessive rounding, there's almost always a cervical component. Mm-hmm. We're looking at cervical axial rotation, possibly side bend. We might get into cervical cranial issues later on down the road after we've tried to reestablish some basic core principles.
Do you ever use manual therapy?
Yes, we do. We use brachial chain, postural restoration brachial chain techniques can be really effective. We learned some manual techniques with in the Schroth training. Mm-hmm. I personally don't use those very much, but sometimes people need a little bit of extra help to loosen up really tight musculature. When we can't do that manually, we might be able to do that with inhibition, postural restoration inhibition techniques that just turn off muscles. Mm-hmm.
The need for activity but also dealing with fragility.
Right. Thank you for bringing that up.
How people, and especially and especially for older people, because, you know, we talk about scoliosis a lot for younger people, but, you know, what about people who are older and have acquired scoliosis through years and years and years of compensate at life, basically?
Well, also for younger people, because younger people, so I'm going to start with younger people,
Okay.
but older people are real. No, I'm so glad that you mentioned that and brought that up. Younger people need to be active. There have been studies of kids who are involved in sports versus kids who aren't. And kids who are involved in sports are moving and going through all different positions. They tend to do better and have better curve reduction and curve control than kids who, you know, are just very sedentary, don't move much, don't like to move much. So we really encourage sports and activity for young people. But we also say, if you're going to choose a sport, you're not already invested in one, look for one that doesn't have a lot of repeated patterning. Like, for instance, I had one patient who ended up doing fencing, and fencing is like all right side dominant reach.
Yeah.
And took her into her pattern so much that it just didn't work out for her at all. And she eventually had to give it up. It was hurting her.
Yeah.
Things like gymnastics are not that great because it takes people into all those extreme positions we said you want to avoid.
Yeah.
Well,
what would be a good one?
So, you know, I'm not any ball sports for the most part. Some people say swimming is great. Some people say swimming isn't great. They haven't really identified the optimal sports yet. So
I think tag. Everyone just play tag, because you're just changing directions, and you're not constantly going. You're not constantly throwing with one arm. You're not constantly kicking with one leg. You are running away from people, running towards people, grasping objects with your vision, pulling them closer, shifting from side to side with no obvious pattern to it, because you're just running all over the place. I think everyone should just play tag.
Play tag. That would be great. Nice. I mean, people do all kinds, but that's great, really.
Or laser tag. I don't know if they still have laser tag.
Yeah, a lot of the young girls that we see are dancers, and dancing is, you know, kind of on the verging on gymnastics. But, you know, people who already have a sport that they love and they're invested in, and it's part of who they are, it's really important not to take them out of that sport, but to give them the possibility that maybe after you've danced, maybe you do a couple of exercises just to rebalance so you don't stay stuck in your dancer body, and you get back to your living body that you're trying to rebalance. And we would say that with most sports.
How about running, like high speed running?
Yeah, you know, the impact is, I've had a couple of people who love to run, and, you know, it's probably an okay thing to do. It really, I've just gone with sports that people have found that they feel good about.
The fact that you can use your understanding of patterns and how that this pattern will change their ability to abduct that right leg, that no one else would catch because they don't understand patterns. I was watching a special on this quarterback who played for Alabama, and now he's with the Dolphins, Tua Tagovailoa. I don't know how to say his last name, but he got hurt. I guess it was his senior year or his junior year in college. His final year of college, he really got a horrible hip injury, and to the point that they weren't even sure if he was going to be able to continue. But you know, he rehabbed and he got drafted, so he's with the Dolphins. But they were showing his rehab routine, and they had the doctor, or whoever it was that was rehabbing him, had him laying on his left side and abducting his right leg. And what did you actually see him do? Right abdominal wall closed immediately. There was no abduction of that right hip. I mean, there was a little, I mean, there was a little bit, but that he was abducting through his right lateral abdominal wall. It was so obvious. And I'm like, how much money is this guy making? He can't even see that you're not abducting. And he had a weight on his ankle to make it even worse. All he's doing is strengthening his right abs. And it was so clear. I never would have caught that 6-7 years ago. I never would have noticed that. And I remember James Anderson used to call on the Gainesville hike until they said, because it was at Florida that he saw someone doing it and someone asked him not to call it that anymore. So, but anyway, that in my mind, I go, that's the Gainesville hike. It's so odd. Once you know it, it's so, you know where to look. And someone who doesn't understand the patterns doesn't know where to look and won't be able to know, well, let's just stretch something. And of course, that's not going to work.
That right abduction hike is something that's also very common in people who have a right thoracic curve and a left lumbar curve, because it's even more exaggerated because of the curve patterns. They're tighter on that right low back because of the curve pattern. And that's one of the things that we highlight as something to watch out for. Be sure they're not using their right ab wall to do their right abduction.
And for anyone watching, I actually made a video of this a couple months ago, so you can actually look it up, what it would look like.
Excellent. That's one of the modifications that we do to one of the postural restoration exercises, where they're lying on their left side with their right leg on a crate or a box or something. And we don't have them put their leg above their hip height initially. We keep their leg at the level of the hip. That's just a different exercise, so that they aren't encouraged to use right ab wall. So that's another modification that we would use.
That's a huge one. I teach people specifically to reach with that right leg before they even do anything. It's part of my online learning. Like, you have to learn particular skills that you will then incorporate into these techniques. But if you don't learn how to reach with that right leg and elongate that whole right side, you're never going to be able to do this properly. So I break it up into little skills. You're going to learn how to reach with your right leg. And I have a video showing this is what you have to do to learn how to reach with that right leg and elongate that entire right side, which in and of itself is a technique, because if you elongate, inhale, you've got expansion going on, you've got an inhibition going on. So even just learning these little skills are actually very beneficial techniques all by themselves, even without the actual technique part of it. But of course, you could say that is the technique. So, just how you look.
Absolutely, and that's the beauty of postural restoration, which is why we use 80 to 90% postural restoration, because it's just so insightful, comprehensive, and integrated. For sure. That's a really nice to hear, Neil, that you do that reach, because that's very basic for us too.
It's such a huge thing. And when you don't understand it, like I didn't understand it for the first 4 years, probably. Like there's different levels of understanding. Like sometimes like, oh yeah, you got to elongate the right side, but you don't know what that means completely until you get more experience. And then you start to see people, when you start to see the compensations occurring that they talk about in class, in the seminars, and you're like, that's what they were talking about. It just makes it gives you a different level of understanding. It's like, yeah, okay, we have to elongate the right side. But then when you see someone shorten their right side as they try to pick up their right leg and their neck goes like this, like, oh my God, this person really is using their right neck muscles to try to abduct their leg. It just gives you a different understanding at a different level. And then you understand what people really learn. They need to learn how to really reach with that right leg. So it's just different. It just gives you a different level of understanding. I know, it's like when you see the compensations and you're ready for it, and it means something to you, and you know what you're looking at. Because sometimes you would see something like, I know that doesn't look right, but I'm not sure what it is. That's like that unconscious. It's like that would be conscious incompetence, right? Unconscious incompetence. I don't even know that person is doing that technique incorrectly.
I don't even see that they're doing it.
Yeah, and then you're like, okay, something doesn't look right, but I'm not sure what it is. So that would be the unconscious incompetence. And then you're saying, I know what just happened. And now you've got more conscious competence. You're just doing, you're at that different level of understanding. But in the beginning, you're like, it looks okay to me, I guess. I don't know.
I don't know, right?
Yeah, but it's a progression.
Yeah, you know, all of us postural restoration practitioners recognize that there's no end to the journey. That
None.
is always more to learn and understand, and the growth is just, there's no end to it.
It makes you, it humbles you.
It humbles you.
And the best thing you can do is just admit that you don't know everything.
Yeah.
And it's because because the highest level PRI people are going to know you're full of it anyway. Because everyone, that's what I love about PRI, is everyone is humble. Mm-hmm. When you have instructors, people who have taken, someone like Dan, who has taken something like 50 seminars, or Lori, who works at the Institute, she still goes to seminars and asks questions. And you would think her ego is so high, which it isn't, but you would think that someone that reaches that level of understanding would be like, hey, I know everything. And yet there she is, taking the non-manual techniques workshop with me and asking Ron a question. And then Ron saying, you teach me, I learn from you. Like the fact that he tells people that he learns from them, the same way that, you know, it's keeping this open mind that no matter how much you know, there's still others, there's just going to be always so much that we don't know. And it's not because there's nothing wrong with not knowing, because as a professional, we definitely have this kind of, a lot of people will have this idea that, well, if I get to a certain level, it means I should know everything, otherwise I'm a fraud. Like, you don't want to feel like a fraud, so you want to be like, oh, I know everything. But everyone knows that's not true. So just it's a humbling experience. You're just going to keep learning, and you're never going to be able to see everything. You know, I cannot deal with what you are talking about right now. I don't have that experience level and expertise of dealing with scoliotic patients. I told you last time we talked, like, that frightens me, that how you have to know how that spine really is and position them accordingly so that you don't reinforce something that they're already doing. Like, you know, I wish I had that level of experience. I just don't. So I have to be, you know, I have to admit it and ask people like you, like, what do you do for these people?
Yeah. I don't think it would be impossible for you to learn, at least, you know, guidelines.
Yeah.
Because sometimes when you just look at the way a person is doing a technique, mm-hmm. you can see their spine straightening out. You can see air going where it needs to go.
Right.
But it really does help to have a little bit of an understanding of what is actually, what that spine looks like, for sure.
I don't want to hurt anybody.
Right. No. None of us want to hurt anybody.
Right. And that's what I worry about, is, you know, having been in that position, I would feel so responsible for that. Even though I'm doing the best I can, you know, that idea of someone ending up in pain because I couldn't see what needed to be done because I just don't have that experience. But of course, you never really learn until you actually try. But at the same time that you're trying, you may not always have a favorable outcome, depending on the situation. And you have to kind of accept that. And that's one of those hard things for therapists and anyone who's helping other people, is you need the experience, but at the same time, you might have some experiences where people feel like not very good.
I think you really need to listen to what people are saying to you. You need to really hear what that person is experiencing. And sometimes you still don't know the answer, but you know, there's something that I have to be sensitive to.